Welcome back to Out of the Rough. I'm with Dr. Cynthia Thaik, and Dr. Cynthia Thaik was the founder of Revitalize You, a new body image. And what's really interesting is you're Harvard educated, a cardiologist, and you came back here to the Santa Clarita Valley to really help people become healthy. Tell us about Revitalize You.
Well, this is a wellness center that we just opened our door and had a grand opening ceremony with the chamber just 2 months ago.
And thank you for being a member of the chamber.
Thank you, thank you. And you know, I brought Revitalize You here. I've been doing cardiology for the last 20 years. And over the last year, I've been offering this diet program, which was designed by a physician out of France 25 years ago. And it really has had amazing results. We've achieved over 5,000 pounds of weight loss in just this last year. But more important than that, for me as a cardiologist, I've been able to get my patients with blood pressure issues, diabetes, high cholesterol off their medication and really change or reverse their pathway towards developing heart disease. And to me, that's phenomenal.
Oh, yeah. It's important that we take proactive steps for our own health. Look, the government's not going to take care of you the rest of your life. Your employer's not going to take care of you. Take care of yourself. I mean, make it happen now so you don't have to worry about all those things as you continue to age. And if you're older in age, if you're more senior in age, you know, it's never, it's always the right time to get healthier, isn't it?
Absolutely. You know, all too often, I think patients don't realize that they are consumers within the healthcare industry. And I really encourage people to think of it in that manner. I mean, they are here, and we as physicians, as provider of wellness, are here to service them. And they need to really be proactive. It's amazing to me how many people, when they go and shop for a car or a television, do all sorts of research. But when it comes to their health, they're fairly passive about that. Yeah,
and it's important. Now, let's talk about heart disease, because that's important. Let's tackle that. What are the different types of heart disease that patients should be aware of?
Well, I like to think of that in 3 different categories. Cardiovascular disease, the development of blockages, the heart attack is what most people think about when they refer to heart disease. But there's 2 other components that I want to touch on. One, you know, I look at the heart as having 2 functions. One is the mechanical, the pump, and when that fails, that's when you develop heart failure. And then there's the electrical, the arrhythmias, palpitations, so forth. But when we talk about cardiovascular disease, vascular being cerebral vascular in terms of strokes, cardiovascular in terms of heart attack, and peripheral vascular in terms of blockages down the legs, aneurysms, and so forth. That is by far the #1 health risk to all Americans. I mean, it's the leading killer of heart diseases.
Yeah, and what are some of the risk factors you need to look at when it comes to tackling this challenging disease?
Yeah, well, I tell people that while we're all aware of heart disease and are concerned about it, most people are not proactive. They wait till they develop symptoms and then they come and see a doctor. But really, and we can define what your risk, your likelihood of developing heart disease is based on a set of risk factors. High blood pressure, diabetes, cholesterol, a family history of heart disease, smoking, and now we're going to throw in obesity, because obesity is becoming and has been deemed the 2nd leading preventable cause of death in the United States.
Yeah, it's so important. I was talking to somebody in an earlier show, and we talked about kind of the way you present yourself. And just losing a few pounds, how good you feel about yourself, and it creates momentum to feel better.
Right.
And the same thing is, if you really watch your fitness and you watch your diet and you watch who you are, it really helps so many other challenges or diseases you could potentially have, doesn't it?
Absolutely, and all those risk factors are tied in together. A lot of it is centered on insulin resistance. That's the cornerstone of obesity. Mm-hmm. Sadly, 2 out of 3 adults and 1 out of 3 children are obese. Okay, and that ties into high blood pressure. 70 million Americans have high blood pressure, and only about 80% are aware of that. And then when you get down to diagnosis and treatment, the number falls to 46% of patients with high blood pressure who are actually aware of and are getting treated.
And it's important that you get treated. And Revitalize U has a treatment center here in the Santa Clarita Valley. Tell us a little bit about the services you provide.
Yes, well, there's first and foremost cardiology. And so I do that in terms of consultation, treadmill, ultrasounds.
EKG?
Yeah, absolutely. Yeah, Holter monitor, event monitors, tilt table testing. So we do the whole gamut as far as cardiovascular diagnosis and symptoms for patients to be aware of. Chest pain, shortness of breath, palpitation, dizziness. Oftentimes, women tend to present with atypical symptoms, and I always really want to highlight that because as mothers, as wives, we don't put enough emphasis on our own health.
Right.
And
I would agree with that.
Yeah.
My wife is running 100 miles an hour as the CEO of our household,
right.
and she's concerned about all 5 of us.
Right.
Other than herself.
Yeah, and so sometimes the subtle symptoms that women present with as far as heart disease is concerned gets overlooked,
right.
Okay?
Yep.
But then, so that's the cardiovascular, and then, like I said, really out of trying to modify these risk factors, Revitalize U was born. We do everything from, nutritional counseling, coaching, to the Ideal Protein weight loss program, to Kathy Silvers, who's a professional chef that, she herself is a raw food veganist, but, she teaches the whole, arena of healthy, healthy living, healthy eating, and that is so key. I mean, where the standard American diet has led us in terms of the processed food, getting, away from our fruits and vegetables, the number of patients who nutritional score is really...
Well, can you give me a quick fix? Because there's just a shake I can drink and that's it, and I could be 100% healthy. No, I get it. So there's so much to it, and there's so much we can continue to talk about. But Dr. Thaik, how can those that really want to get more information about how to be healthier, how can they reach you?
Well, they can call our number. We're right here on Cinema Drive, 23501 Cinema Drive. Our phone number is 661-222-9057. They can also go onto our website, and that's revitalize-u, the letter U.com.
Excellent. Thank you very much. It's a
Thank
pleasure
you.
to meet you.
Thank
you for all you're doing for all of our parents and all of us out there that want to be healthier.
Okay.
Great. Thank you. We're going to jump to a quick break, and we'll be right back.